Great, thank you very much. And thank you for the introduction and the punchy welcome tune as well. It's a pleasure to see you all. Sorry to interrupt your lunch, but we have a really special 15-minute insert before the rest of the afternoon starts, and it's a real pleasure to introduce Bettina McMahon. As Kim said, she's the CEO of HealthDirect Australia. But Bettina, please put yourself into context. What does being CEO of HealthDirect Australia actually mean?
HealthDirect Australia is Australia's virtual front door to the health system. We had 75 million interactions with Australians last year of a population of 26 million. Now, most of those are digital, and it's when consumers don't know what to do or where to go, they contact us. We had around 4 million calls that we serviced, and we help people understand their symptoms, care for themselves and their families, and find and connect to care when they needed to.
So hold on, so you've got one single system for primary care for the entire country?
I wish we did. So we have a single funder in the federal government for primary care and about 8,000 privately run practices. We have hospital systems run by the 9 state territory governments, and we have a range of other mix of private and public service and virtual and other care.
So this is even more complex. So actually have a virtual digital front door to healthcare that links to a whole group of different providers behind the scenes. That sounds incredibly complex.
Yeah, it's irrespective of who pays for it, who provides it, or the channel for care.
Wow. So you're obviously in the heart of government, you're rolling out a national program. What have you seen has changed? What's been the role of government in this digital health transformation over the last decade?
I've worked in the healthcare sector since 2009 in digital health, and our focus really in the first 5 years of my career in this industry was very much on automation. It was automating paper systems, it was changing manual processes to ones that were powered by digital, but it wasn't really about transformation, it wasn't about new models of care. And I've seen in the past few years, really since COVID, that we're focusing much more on how we can do things differently, of how we can reimagine how we're providing consumer services, how we can bring them together in a way that's not organised around bureaucracies or health service boundaries, but that respond to the consumer's needs and to personalise their medical journey.
I think that's right. I think we've seen a big transition from paper records to electronic medical records.
Yep.
And often that transformation, which has been driven a lot by governmental policy around the world, has been very much digitising the paper forms, but in actual fact the forms themselves don't change, they just turn into digital forms. I think what we're talking about here is actually just changing the need to have forms at all and going one step beyond. Is that where we're going?
It was an important first step to digitise, and don't get me wrong, we haven't even finished that journey yet. Fax machines are still a primary method for communication between hospitals. So we haven't even completed that first part of the journey, but it will only get us so far, and it will continue to deliver the same results we're getting in the health system today into the future, and none of us can afford that.
So I just want to go back to the digital front door that you've created for the whole of Australia. So just tell the audience who may not be deep into health and sort of technology, what does the digital front door do? What's a patient experience when they contact the system?
Sure, so a patient will contact us through either a digital channel, there's an app and there's a web channel, or the phone, and we'll ask them a series of questions about their characteristics, their gender at birth, their Indigenous group, any underlying risk factors, lifestyle factors such as smoking or alcohol consumption. Then we ask about a number of their symptoms, what's bothering you at the moment? And we can collect all of that information. We use an AI system, a probabilistic inference engine, to consider all of those symptoms and risk factors together. And from that, we determine the urgency of the consumer's condition, the sort of care they need, whether they can self-care. If they can self-care, we give them quality advice. And if not, we connect them with other general practice or potentially an emergency room or ambulance.
Wow. So AWS supports healthcare organisations from federal, national governments, hospital systems all around the world. And it's amazing to hear that you're leveraging this kind of technology to deliver this at scale. When you're thinking about scaling something of this across Australia, was cloud the first place you went to? Did you start building on premises, then shift? What was your journey to get there?
Yeah, so HealthDirect has been in the cloud for over 10 years now, and we really needed to do that because our business is very much scaling and surging. So our peak period is 6 to 9 p.m. at night, where we get double the number of interactions that we get at other times during the day. Over the winter flu season, we have a huge surge, and also over our Christmas break, which is our summer holiday, and a lot of practices close down. So we need the elasticity of cloud to be surging up to give us the capacity. Also environmentally, we don't want to be hogging the energy consumption of standard servers even in the cloud. We need serverless infrastructure to meet the needs and to reduce our carbon footprint.
And I think that's a thing we're seeing as the amount of healthcare data scales exponentially and the workforce is being stressed by the amount of work they've got to do. Burnout's a real thing,
Yeah.
and with an aging population as well. We're seeing this kind of problem occur all around the world where the need to innovate and scale, because as Andy Jassy says, scale breaks everything. Bringing this kind of scale to bear is really important. So some of the other things that we're seeing is the absolute need for security as the bedrock that drives everything, and then the business continuity. So how are you, what are your needs in those regards? Because it's hard to innovate. Healthcare is a difficult space to innovate in. How are you finding innovating in this very regulatory constrained environment?
It is. So for HealthDirect, we're Australia's trusted provider of information and triage services. And the worst thing we could do would be to have a major cyber breach or a major downtime. And so that's what cloud gives us to maintain that trust. If we were to lose the trust because of flaky services, it would be a real problem. But like you say, Roland, we can't just continue the way we have. So we have to operate a highly resilient, high availability service at the same time as trying to innovate, and that's my challenge.
Now, you've just published a paper in New England Journal of Medicine for AI. So again, congratulations on your publication. And the paper really looks at digital front doors, so how patients get their care around the world. And so you looked at different countries and their different systems. What insights can you share from other countries and kind of a global perspective of how other countries are also doing it?
We've learned a lot through the last 2 years of using AI in our front door. One of the things we learned, and we talk about this in the paper, is that often minority groups present with symptoms that are atypical. They're different to what a regular or a more normalised population would have. Women, for example, even though we're not actually a minority group in the medical sense, you would know this, Roland, there's not a lot of research, and so often our symptoms are not recognised. For heart attack, I don't know if women in this room know that the symptoms that women present with for heart attack are very different to those of men. It's typically things like nausea, lower back pain. There might be a little tightness in chest, but not the crushing chest pain. So these are the symptoms that women present with, and often they misdiagnose or they don't even know initially what the problem is. Unfortunately, a lot of our general practice also don't recognise that necessarily. And so having a front door where we can use AI, which does know this stuff, the underlying foundation model captures all of this information, and it can identify serious conditions that either might be rare or might be specific to that demographic. So this is something that's improved quality and safety and life-changing for many people who approach us.
Absolutely, it really brings that personalisation to bear, so you can really understand different demographics, different ages, different sexes and what they present with. So if you're interested in the paper, it's called Right Cure, Right Place, First Time. So I think that's going to be fantastic. Now, you mentioned generative AI, and it wouldn't be a panel if we don't mention generative AI at some point. How are you leveraging Gen AI as part of your digital front door?
One of the policy priorities of having a digital front door is to better serve vulnerable communities and different groups who are currently underserved. In Australia, 22% of households speak a language other than English at home, and about 3% of Australians speak English not at all or very poorly. At the moment on our phone line, we're only servicing less than 1% of consumers in another language. We do offer translation services, but they're very underutilised. So again, like the rest of the health system, we're underserving those populations. So we've been working with an AWS partner, Trust.ai, on real-time translation on the phone line so that a consumer can call in, speak their own language, and in real time have that translated for the nurse at the other end, and then have it translated back. We think it'll massively increase the consumer experience and hopefully the uptake so we can better serve those communities.
I think that's really interesting. I think that's one of the really things that I'm excited about with Gen AI in healthcare in particular, the ability to be language specific, to be able to communicate with patients at their right educational level, because not all patients understand the information and the content they're given, and also to speak in a voice that's culturally sensitive, and especially we're talking with different groups and different ethnicities. Gen AI is a really powerful tool to make sure that information is conveyed in the appropriate way. It's interesting, we're seeing engagement with digital tools also in the US. Obviously, there's a lot, we're in discussions with the new administration, and they're looking at great examples of examples around the world about what to do. We've actually got some really good examples in the US as well. So there are organizations like HealthDirect, so it's an AI company that's working with Stanford, and they've demonstrated that patients have twice the adherence to their medication when they're engaging with generative AI tools, because they're able to interact with a digital agent which actually helps them understand the needs for their medication and to maintain it. So looking ahead, what does success look like to you in 2030, for Australia and the global healthcare community?
You mentioned the current administration's focus on the future. And one thing that I really admire about what you're doing in the States is the focus on chronic disease. So one thing you don't know about me, Roland, is how I'm going to die. So 3 of my 4 grandparents died of heart disease. So that's probably what's going to get me in the end. But the challenge of chronic disease, like heart disease, is it doesn't just happen. It's the combination of, it's multifactorial. It's the combination of multiple things over many, many years that get you to that point of chronic disease. That's why it's so hard for us to address. So for me, I've had this ring for a couple of years now. Each morning when I wake up, I look at 3 figures. There's one which is resting heart rate, one which is heart rate variability. It gives me a score out of 100 for both of those, and one for readiness, which is something to do with, I don't know, it looks at anxiety from the day before and a bunch of stuff. Magic happens, it gives me a number out of 100. That's all I need to know. And based on that number, I think about, well, how far should I run today? What time should I aim to get into bed? And whether I should skip that Negroni tonight or not. It's these tiny little decisions.
Never skip the Negroni.
Okay. You're the doctor, so you would know. So it's these tiny decisions that I can make every day that are data-driven and highly personalised to me that will change 10 years, 20 years' time, the trajectory of my health to develop this chronic condition. So the thing that really excites me about the future and where I think we'll be in 2030 and 2035 is for consumers at mass using these sort of wearable devices. And I wouldn't be surprised if, actually show of hands, who has some sort of wearable device, whether it's a watch or a ring or some other thing that they use on a regular basis. So about 1/3 of the room already is doing this. And I feel like we're already in this revolution, that we're already seeing people making these decisions every day. This has nothing to do with the health system. It's nothing to do with government organising it. It's a groundswell of technology providers providing this to consumers and consumers picking it up because it helps. So at some point, I see the intersection of this world that we're seeing with the world I'm in, which is representing the health system and providing a virtual pathway in.
And as a point of information, the Aura ring actually runs on AWS. So all that inference and analytics is now running today in the AWS cloud. Thank you very much, Bettina, for sharing your insights and the incredible work you're doing across Australia to improve the lives of patients. We're delighted as AWS to be able to support your mission, and thank you very much for joining us here today and for speaking to our executive audience.
Thanks everyone for the opportunity to speak.